The video you are about to view depicts an interaction between Helen, a registered nurse, and her patient, Mr. Cyril Smith. Mr. Smith has a medical diagnosis of bowel cancer and has been admitted for surgery. This is not a perfect interaction. It was specifically designed to prompt you to think like a nurse. This video will help you to understand the importance of clinical reasoning as you reflect on the scenario presented. While there are a range of clinical issues raised by this scenario, pay particular attention to how clinical reasoning, person-centred care and therapeutic communication are illustrated. This brief interaction illustrates the first two stages of the clinical reasoning cycle, considering the patient and collecting cues. As you watch the video, you will observe how Helen moves forwards and backwards between these two stages, collecting information while at all times seeking a deeper understanding of Mr. Smith and his current situation.
Mr. Smith?
Yes?
Okay if I come in?
Yes, love, you can come in.
Thank you. Thank you.
Hello.
Hello, Mr. Smith.
Hello, how are you?
My name's Helen. I'm the registered nurse who'll be caring for you this afternoon.
Oh, all right, love.
I just wanted to come and have a little chat with you and just to familiarise you with some of the things that will be happening to prepare you for your surgery.
Oh, all right, it's a bugger, isn't it?
It is. It is.
Yes.
What do you understand about what's happening
Well,
to
I
you?
got... What's that stuff you're rubbing on there? It stinks, doesn't it?
Does it? This is some hand prep. I wash my hands, but this is to make sure that everybody has.
Oh, so you don't give me germs.
Absolutely,
Or nothing. Yeah.
absolutely.
No, I got cancer, love.
So what do you understand about your
Well,
cancer?
they're ripping me bowel out.
Okay.
And I don't know whether they're going to give me a bag or not, but that's what they said they'll know when I get round there, what they're going to give me.
Actually, the stomal therapist will be coming to have a little chat to you.
Who?
Before. She's called a stomal therapist.
Oh, she's the thing that you got the stuff hanging out your belly and it goes into a bag. And you poo in a bag.
She will come and consult with you to find out where might be the best position if you do need to have.
Yeah, but they said they don't know whether they'll do that yet or not.
That's exactly right. Okay, so I'm just going to have a brief look. You've had most of your admission done, but the formal things, your observations, Nurse Lee, she's one of our staff. Lee?
She's
Lee.
a student.
She is?
She's good. I've had her before.
And you've told her that?
Yeah, she's marvellous.
Oh, well, that's good. Well, she'll be coming in to do all your pre-operative observations and to settle you in more formally.
All right.
I noticed here that you live alone.
Yeah.
You do?
Yeah,
Okay.
Joy. My wife died 2 years ago.
Oh, did she?
Yeah.
Oh, okay. And how are you managing?
Yeah, no, don't rub me just yet.
Okay.
You can
I beg
when
your
you
pardon.
get to know me a bit more.
Okay. Okay. It's
Yeah.
okay. Thank you. Thank you. Right. Well, oh, this is Joy here. This picture.
Yeah.
Yeah, that's a beautiful
She
photo.
was a beautiful woman.
Oh, I'm really pleased to hear it.
Joy.
And you've got some next of kin details here, but no one's in direct contact at the moment. You've got
I got one daughter here, love,
Mm-hmm.
and I got another daughter in America,
Right.
New York. She's coming out to look after me.
Is she
Yeah.
coming out from America?
Yeah, she'll work with me other daughter, Doreen.
Mm-hmm. Okay.
And then I had a son.
Oh, okay. You
Yeah.
had a son.
Yeah. And it's times like this that you wish they was all here.
Absolutely.
Yeah, Joy too.
Well, you can speak with us, and what we'll try and do is work out all of the support systems that you might need in the around this time, and we can call people so that you can make contact.
That's marvellous.
Okay. Well, look, some of the things that's going to happen with you this afternoon, Cyril, can I call you Cyril?
Yes,
Cyril,
you can call me Cyril.
is we've got, see this little
No,
packet?
no, I don't need none of them.
These are called TED stockings.
Yeah, no, I don't need none of them.
What makes you think that?
Because I got yours on ones and that'll do, because they cost a lot of money,
Well,
so I don't want to pay for them again.
look, normally they do cost a lot of money, but this is part of our care for you, and it's part of the normal hospital costs. So
Oh.
to be sure that the stockings are the right ones, what Lee will do is measure your leg up and ensure that you get the right fitting TED stocking
Oh, all right.
this afternoon. So that's what that one's for. And then these snappy little numbers, look at this.
What's that?
They're actually non-slip socks.
Well, I'll be bugging.
Yeah, well I noticed when
Well, you can wear them and you don't slip over.
That's exactly right. So what we'll be doing is
But
introduce...
they got that stuff on the bottom.
It is, it's good, isn't it?
It's marvellous.
Because I noticed when I was reading your history here that you actually had walk with a walking stick.
Yeah, but I didn't bring it with me, love. I left it at home.
Okay, and the reason you use a walking stick?
Oh, just because I get a bit of a stagger on this side.
Okay.
Yeah.
Is that in relation to that old fractured ankle you had?
Yeah, that was years ago.
Years,
though.
yeah. Does it hurt?
Oh, it gets cold. When I get cold, love, it hurts. In the winter time, it hurts. They get a bit arthritis in it.
And do you take anything for that, Sarah?
Yeah, take some tablets for that.
Do you? Well, that's important we know about that when we take your medication history. One of the other things that Lee will be doing too is this little device here.
What's
and,
that?
Well, it's called a TriFlow, and it's to just determine how well you're breathing, the capacity for your breathing. Because I
What's them balls got to do with it?
she'll actually take you through the
all right.
the technique,
Yeah.
and you need to be able to demonstrate to her that you can push those up. I noticed you had a diagnosis in here of
Oh, what?
a medical diagnosis. It said that you'd been a long-term smoker.
Yes, I was a smoker, love, years ago, but I stopped.
Okay, but that you actually have a bit of a chronic lung disease. They call
Yeah, I
it.
get short wind.
You get short wind.
Yeah.
Yeah. Well, that's even more important that we understand how well you can breathe to prevent any complications from occurring from the surgery. So
Yes.
before,
A lot
during.
of fuss, isn't it?
Oh, it's all about
Yeah.
taking care of you.
Yeah, a lot of fuss seems like a lot of things but I suppose it's a big operation.
It is a
isn't
big operation, and if we work together on all of this to make sure we can do it as most appropriate for you. Now, one of the other things is part of the preparation for the surgery is about the bowel preparation.
Oh no, they give me that last week, love. I don't want none more of that. I was pooing through the eye of a needle by the time I finished.
Okay, so
Yeah, have you ever had it? And my ring was as red as anything. And I don't want no more of it, love.
okay, well, so that was part of your preparation for your colonoscopy, and that was.
Yeah, what's that word again?
The colonoscopy was that procedure.
That's when they stuck the camera up me backside.
They did.
Yeah, well, they give me that stuff to drink, and it was shocking.
Yeah,
I'm not having no more.
You're not having any more.
No.
Okay, that part of the preparation for your bowel, in order to minimise any sort of infection and to make it go as safely as possible, the surgeons need to clear your bowel of any debris, and that's, I know, it's called a pico prep.
A what?
A pico prep. And
Oh, I'd like to pike it right back at them.
I know.
Because I dearly don't want it, but
Well,
if
this-
they say I've got to have it, I'll have it.
well,
I've got to drink the whole lot.
yeah, over the next 12 hours. But Lee will work with you on that, and she'll have a chart, and she'll come and remind you to try and prompt you to get through all of that.
Whatever, I suppose I've got to do it, don't I?
But last but not least, Mr. Smith, I need to talk to you about pain management.
Yeah, no, I'm tough as nails, love. I don't need no pain management. I'm pretty strong. I've been a bushy all my life. I can cope with anything. So
Okay.
don't worry about
Well,
pain.
when you come back, you will come back with a drip and a machine there, and we'll explain to you about.
Yeah, but you can tell them not to worry because I won't need it.
Okay.
Yeah.
Okay, well, I'll take that on board. So, the last thing I've got here that's mentioned is that you've got diabetes.
Eh?
Diabetes. You've had diabetes type
I've
2?
got a bit of sugar.
Okay.
Yeah.
Okay, so that's what the doctor's written as diabetes type 2. So how do you manage that?
Oh, no, it's all right, love. Me wife Joy used to fuss about it, but it's no problem now.
but you've
I
had
just eat whatever I like. Take a tablet now and then, and that's all right.
had a bit of weight loss in the last
Yeah,
month?
but yeah, I think it's got to do with the cancer. But I used to, I told the doctor earlier that I let me belts in me pants. I reckon I can pull them in 4 times more than I could before.
Okay. And just, I'm noticing as I'm looking at you that you've got a fairly thick pair of lenses in your glasses there, Cyril.
Yeah, yours aren't bad yourself.
Okay. No, as we all age.
But I can see you better with these ones.
Yes, yes. So, can you see much without, if you
I
don't
can't see a damn thing.
Oh, okay. Okay,
Yeah.
well, all of these things. Well, look, you've been really helpful here, Cyril. I might go and ask if you're ready, and if it's okay with you, I might ask Lee to come in and start doing your, taking your observations and
Yeah, she's
filling
good.
in the rest. Okay.
All right.
Oh, thanks.
What was your name again?
My name's Helen, and
Helen.
I'll be back later on in the evening.
All right. So you're here the whole shift?
I am, yes, until 11 p.m. tonight.
All right. So I've got you and
Lee. Yes, yes,
Yeah,
absolutely.
she's out there somewhere.
Yeah, she'll be. I'll go and ask her to come in and
Alright.
see to you soon.
You're right, I
Okay,
love
is there anything else you'd like to
No,
ask me?
no,
Or?
I'm sick of questions, really.
Okay. Anything
They've
you'd
been
like to tell me?
sticking things in me for the last month. I'm at it. I just can't wait to get it all over and done with. And if I get a bag, I'll get a bag. If I don't, well, I don't. Yeah, all right.
Okay.
See you later.
Thanks for your time, Mr. Smith.
Yeah, you're welcome.
Bye-bye now.
Oh.